So presenting acquired case of synergistic convergence after craniotomy. So basically synergistic convergence is adduction happening during attempted lateral gaze. It is seen in congenital cases like CFEOM, horizontal gaze palsy with progressive scoliosis and brainstem dysplasia, or acquired cases of ocular misinnervation and posterior fossa tumors. So a 6-year-old girl, she presented to us with her mother complaining of squinting of eyes since 4 years, especially in lateral gaze. She was detected with ependymoma grade 2 fourth ventricle in 2018, for which VP shunt was done. This was followed by tumor resection in September. After tumor resection, the squinting was noted. She underwent chemoradiotherapy. These were her pre-VP shunt and post-VP shunt as shown by a mother, which shows orthotropia. On current examination, she was 6/9 and 6 BCVA in each eye. Bilateral abduction deficit with simultaneous convergence was noted in lateral gazes. There was no globe retraction. Meiosis was noted on lateral gaze. Vertical gaze was intact, and even on ductions, there was abduction deficit. So if you see a 9-gaze picture, primary gaze, there is right ET and convergence in dextro and levo versions. This is her video. So in dextro version, her eyes are converging and also meiosis was present. Vertical gaze was intact. So Worth-4 dot test showed right suppression. Prism bar showed 20 prism diopters in primary gaze, and Krimsky in lateral gazes showed 55 in right gaze and 40 in left gaze. Dilated fundus examination was normal. General examination was normal. There was no signs of cerebellar injury, no ataxia or scanning speech. MRI showed no extraocular muscle atrophy. So the causes could be near reflex spasm, aberrant regeneration or misdirection, or substituted convergence in horizontal gaze palsy. So if you see literature, esotropia do occur in pediatric posterior fossa tumor resections. About 30% and around 17.3% requires surgery. Coming to synergistic convergence. So Kim et al. Showed a 39-year-old male with complete ophthalmoplegia and ptosis since birth. So this was a case of CFEOM. MRI showing hypoplasia of oculomotor nerves. So the cause is aberrant misinnervation, miswiring of the oculomotor nerve. One more case by Christina. She showed a 5-year-old girl with convergence in lateral gazes with globe retraction. MRI was normal in this case, so the probable cause was aberrant nerve sprouting during embryogenesis, miswiring of abducens motor neurons to medial rectus. These were all congenital cases. One more case by Jitendra Jethani et al. Showed 2 sisters having split pons sign on MRI with synergistic convergence. In this also MRI was normal, so they predicted it to be because of substitution of convergence. So what is substitution of convergence was studied by Bijan, BEG et al. They studied 3 cases. Case 1 was cerebellar astrocytoma with left convergence squint with left gaze palsy. Case 2 had posterior fossa tumor with right convergence squint, right gaze palsy, and a Mobius case with bilateral gaze palsy with bilateral convergence squint. So according to them, the area of brain concerned with control of convergence is in upper brainstem and horizontal gaze control is in PPRF. So Lay and Z proposed a model saying there is synchronous activity of vergence and vergin in all conjugate gaze. Vergence in upper brainstem and horizontal gaze in pons, they act synergistically in all conjugate eye movements. Defect in one system can leave the other system intact. So in vergence, accommodation synkinesis occurs when horizontal gaze is paralyzed. So in our case, aberrant regeneration, meiosis is there, but there was no evidence of oculomotor palsy before. Misdirection, in misdirection, no meiosis between oculomotor nerve and abducens, and spasm of near reflex. Episodes of accommodative spasm with blurred vision are seen, which was not shown by the mother. And so this is a case of substitution of convergence in abduction deficit. Previous reported such cases were in congenital CCDDs. And acquired cases post-tumor resection were unilateral, as we saw those 2 previous cases. This is the first case report of bilateral acquired synergistic convergence after tumor resection. She was operated with Nishidas bilaterally, but even 1 month post-op, still there was -3 abduction deficit and -2. These are my references. Thank you.
That's a very interesting case, Dr. Sally. Actually goes more of a neuro-ophthalmological case, but very interesting. Because normally, yes, even I have seen simulated convergence, synergistic convergence in horizontal gaze palsy with progressive scoliosis. So, but this is an acquired one, you should publish it. It's very interesting.
Ma'am, what did you do in those cases?
Can't do anything. You just have to follow them up. No, no, you can't do anything. Can't do anything.